We are live.
All right, g'day everyone. Welcome back to the Snake Catchers podcast. I'm Brett and I'm here, of course, with Dan, as always. And we're back for another guest episode now. It's been a while since the last guest episode that we did. That was with Will, wasn't it?
Yeah, I think so.
Yeah, the only other guest episode we've done.
That was before Christmas.
So you're the second one, so you should feel honoured about that.
Oh my goodness.
We'll give you a little medal after.
Amazing.
We have got Dr Amelia Cottle on today, who is an exotic pet and wildlife veterinarian here in Adelaide. My wife as well. I should probably throw that in there.
Oh, that's
Important.
cute.
So thanks for wandering out the house and coming on the podcast.
I didn't even think he'd mention it, so
Well, there you
that
go.
was pretty good.
It crossed my mind. What's he going to call it?
I should probably,
Yeah.
I probably should
If
just
he
put that,
said
put
partner,
that
I
in
might have
there.
slapped him.
Wouldn't be the first time. So yeah, we're going to talk about, Amelia's going to talk about snake medicine and surgery and all this fun stuff, and probably use a whole heap of terms that we know nothing about or what they mean or anything like that. So yeah, we'll see how it goes, I suppose. So I suppose we'll start, if you could just sort of give us a bit of your background and what you've sort of done over your career so far and sort of where you are now.
Okay, so I graduated in 2020. At that point, didn't really know I was going to go into exotics. I sort of flitted between doing pigs, chickens, cows. I sort of got excited about everything. Then I had a bearded dragon as a pet, and unfortunately she died of an ovarian tumour at some point, and then I got another bearded dragon, and he had a completely different personality to her, which just blew my mind a little bit. And literally, I've always had reptiles as well. I've had a snake since I was really small and a turtle. And then I decided I wanted to do reptiles. So when I graduated, I saw dogs and cats and reptiles. I was pretty much self-taught for a lot of it. Bought all the textbooks myself as presents for myself. And then sort of went from there, and then sort of contacted other local vets that were doing reptiles if I ever needed help. And then it just sort of progressed from there. And now I work on the Unusual Pet Vet, so I can see reptiles basically on a daily basis, which is amazing.
Yeah. We'll talk obviously more about the Unusual Pet Vets a bit later on. But yeah, I suppose next question would be, it's weird asking these questions because I know the answer to this one, so this is just weird. Just give everyone a bit of a sort of rundown on how long study is to become a vet, because there's a lot of reptile keepers out there who think they're vets. You're not. Vets actually do a lot of work, and there's a few arrogant reptile keepers out there who think they're vets. So just give everyone a rundown on that sort of study period and all that sort of stuff.
So we study at uni for 6 years. To get into uni, we obviously need to have a fairly high academic result at the end of year 12 to even qualify for that. Otherwise, you need to sort of find a back way in to get into that course. We do like a week of exotic animal medicine at uni. We get taught that. So everything else that the exotic vets learn is off their own back. So we just study by ourselves to learn more about all these other animals that have different anatomies and physiologies compared to our dogs and cats and livestock and horses, because they're really the ones we focus on at uni. So I was probably studying like 5 hours a day, like at home, other than being at uni, and sort of maybe a couple of hours a week doing exotic stuff, learning about that. So yeah, it's a fair bit of that. And then if you want to specialize in exotics, you've got to it depends on what country you are in, but you do need to do residencies and like a certain amount of years in exotic animal practice as a GP before doing exams and all this other stuff to become a specialist. So I'm not even near qualifying to be a specialist because I need to be like 5+ years in general practice first and then go from there. In general practice with exotics,
Yeah.
not just cats and dogs. So if I was ever to become a specialist, it would be like 10 years in the future.
Yeah. Yeah.
Or more.
So yeah, reptile keepers who own a snake and a lizard, you're not a vet. So
It's quite interesting, like compared to like medical, like human, like medical stuff where they like wouldn't be too far off that either, like a similar sort of time frame at uni and all that sort of stuff.
Absolutely.
I think they're
so it goes to show how much
5
goes into
years.
it.
Yeah, vet's longer, isn't it?
I think they're 5 years, but then they do like a certain amount of years doing further training in whatever field they decide to go into.
Yeah.
Or something like that.
So that's probably almost similar to what, like, if you go into exotic stuff, you have to spend more time in that sort of thing. Yeah.
So just going back to that specialising thing, obviously there's a lot of vets in Australia that will do and see reptiles, but there's actually not that many specific specialists in reptiles, is there? Is it just Josh?
As far as I know, Dr. Josh is the only one, and he's in Queensland.
Who's actually done the exam.
Done all of those things through, because he's from the United States, through all of that system. So to my knowledge, there's no Australian ones. I might be wrong on that.
Yeah, okay. Yeah.
I don't think so.
That's interesting.
Technically one actual specialist reptile vet in the country.
There's a few avian specialists that we've got in our network. But I think it's just Josh who's for the reptiles.
Yeah. So you sort of answered it before, but was working with the reptiles as a vet always the sort of plan, or did you figure that out a bit later once you started doing your degree?
Yeah, I think when I first graduated, I was pretty happy to do cats, dogs, and reptiles. I was pretty happy with that. And then I thought, no, I'm not seeing enough reptiles, and I wanted to see more of them. And that's why we moved to Darwin, so we could see if we could see more reptiles in our job. And unfortunately, that wasn't the case, because in Adelaide, there's actually more need for reptile vets. So I was seeing more here than I was up there.
Yeah, right.
Obviously, population and stuff like that has a lot to do with it as well.
Yeah.
But you did see some cool and work with some very cool reptiles.
Oh, absolutely.
Up there, from sea turtles to
crocodiles.
5 meter saltwater crocodiles.
That was amazing. But I'd only see a bearded dragon maybe once a fortnight.
Whereas it's just about every day down here.
What was it, Wednesday or Monday? I saw 5 bearded dragons in a row.
Right.
It was great.
So that sort of goes on to the next question, being what is the sort of most common reptile you see in practice as a exotic vet?
Most common reptile would be a bearded dragon.
Yep.
Central bearded dragon, and then probably pythons after that. Turtles are probably more. I see probably more of them than I see snakes, actually.
I suppose they're pretty common, aren't they?
They're pretty common. Also, they're always sick.
Yeah.
Always sick. And then snakes are a bit more subtle when they're sick. So I think that's probably part of it, as well as recognizing that they are sick.
Yeah.
Until it's 18 months of them being unwell, and then the owner realizing.
Yeah.
So I'd say that's probably it. And then there's not maybe heaps of them, but we do get blue tongues and shinglebacks.
Are they more so from the people rescuing them when they've been injured or attacked or something like that?
Probably more commonly, but there are some that people who have them as pets from being bred in captivity.
Yeah.
So see a few of those as well. I haven't seen a gecko since I started at UPV, I don't think, but I've seen them a few times as a new grad. I think what else we have. That's probably it.
Yeah, so bearded dragons is the most common.
Most common.
Yeah. Which is understandable, because every second person has a bearded dragon. As a pet?
Do you reckon the bearded dragon is the ultimate sort of first pet or not? Or do you reckon they're actually hard to look after what people think, and they sort of get pushed out a lot?
They are. this actually comes up later in the questions, but
Sorry,
there is a myth that reptiles are low maintenance pets.
Yeah.
So probably maybe, I don't know, 70% of the reptiles I see were like a gift for a child that ended up child lost interest, and that and then the parent has taken over its care.
Yeah.
And the parent always seems to fall in love with them, which is great. But that's super, super common. So I'd say, bearded dragons are fantastic first pets if the child is like not going to lose interest. Because they're super docile. If you handle them a lot, they just sit there and they rarely bite. Even the wild ones sort of rarely bite unless you really try.
They'll bluff you. They'll bluff you a lot, but you're not annoying one enough, it'll give you a job.
Like if you scare the crap out of them, they'll bite you. If you corner them, they'll bite you. But they're super, super friendly, super docile. And snakes are probably the next sort of best pet for, I would say, for sort of a young child as well, because they're quite interactive. But similar thing, everyone thinks they're low maintenance.
Yeah.
And unfortunately they're not.
No. People probably don't keep an eye on their temps and that sort of thing. You see a lot of stuff online of people's setups and that sort of thing, and like not reading temperatures in the right spot, or trying to worry about an ambient temperature instead of having their hot spot at a higher, like for a normal sort of python like that mid-30s sort of thing, like on a hot spot, and not necessarily worrying too much about the other end. You see people worrying about having like ambient temp and stuff where it sort of doesn't really matter as much as long as they can rotate.
Rotate between
the sort of thing.
I think as well, a lot of people don't realise is the sort of lifespan of these animals, like with correct husbandry. Like a beardy can live, between 15 and 20 years with correct husbandry. Like a carpet python could get up to 40 years, so it's a long time.
We had an 80-year-old turtle the other day.
Yeah, that's giving it a crack.
That's unreal.
I mean, turtle is, that makes sense, but
most of them don't get to that point.
Well, just a long neck, or?
I didn't actually physically see it, but Maruka saw it. But it was like a decent size. It was a pond turtle, so it was doing pretty well.
Yeah, just living the best life. That's the thing with turtles. We say this all the time. You either have them inside in a tank in pristine condition, or they live outside in the festiest pond they could possibly imagine.
Yeah.
And they're absolutely fine either way, but you don't cross the two over, because that's when they get sick.
Yeah, because they're not used to it.
Because they're not used to it.
Or that tank one, a filter will break and then they'll get immediately septic.
Yeah.
Not quite like that, but yeah, it's pretty common.
So I suppose with reptiles, how much is sort of preventative care versus sort of emergencies that you see?
So we try to encourage people to bring their reptiles in at least yearly. I prefer to see them, particularly bearded dragons, 6 monthly, because I'd like to check them ideally sort of before they go into brumation, if they are going to go into brumation, or after brumation, because that's when all the female dragons will have reproductive problems, because that's breeding season, so all their hormones are going crazy. So we try to encourage that, and what we always suggest is we at least see them yearly. We do like a baseline blood test to look at their immune system. So we take a drop of blood and we look at their white blood cell count, and sort of check if that's within normal levels, and their red blood cell count as well, to make sure they're not anemic, which is common if they are a reptile that has some sort of chronic disease going on. So obviously with that comes a full health check. So we want to make sure that we're weighing them, checking their body condition, and making sure we're not seeing anything abnormal that maybe the owner hasn't noticed.
Yeah.
And like brumation will cause them to lose weight as well. So we want to make sure they haven't lost too much weight. So 10% is my go-to. Don't want them to lose more than 10% of their body weight.
Over that cooling period. Yeah. And I mean, like sometimes, people will keep their lights and stuff on and they'll just naturally go to the cool end and sleep anyway, even if you're keeping
most of them,
if you're keeping the lights on.
Yeah.
Yeah.
Well, yeah, 12 hours a day or whatever it is.
Yeah.
Once again, if they're in correct
situation.
Yeah,
correct husbandry.
Yeah.
So going on to sort of the husbandry side of things, a lot of the reptiles you see would obviously have incorrect husbandry and stuff like this. So just give us a rundown on why husbandry, temperature, UV, and diet is so important for reptiles.
So we try the best we can to replicate their natural environment in, a tank about this big. You're not going to do that. So we do need to provide them with things that they would normally get while they're sitting in the sun or doing whatever they would normally do in the wild. So we need UV light to basically help vitamin D3 or a precursor to vitamin D3 in the skin to sort of turn into vitamin D3 in the body. And then we need that heat as well to help put that into the liver. So then we are metabolizing our calcium properly. So basically, if you don't have your UV light and you don't have the correct temperatures, even if you're feeding calcium all the time, it's not going to get metabolized or processed through the body. So you need all three of those things to be correct for anything to happen. And these guys need calcium for everything. And the sort of the most obvious thing they need it for is their bones and muscle contraction. So every reptile keeper would come across metabolic bone disease. And while it is very common, there's several different types of metabolic bone disease. There's I think it's 14 types or something like that. So it's not just you're not giving calcium, it's several things.
Things.
It's a lot more complex than it looks like on Google.
Google
or Dr. Facebook as well.
Yeah.
Yes.
Probably
more so Dr. Facebook, probably.
So even if reptile keepers think they're doing all the right things, they might not realize that they need to change their UV light every 6 months because that light will naturally stop emitting UV. Or they might not realize that, just being warm or having the correct temperatures in the tank means nothing until you can give me a figure.
I know you tell me this when people come in and
I ask them about
husbandry
the
issue. Yeah, and
they say, "Well, I've set it up. I've got all the correct temperatures." And I'm like, "Well, okay, what are the temperatures?" I don't know. Okay.
So we don't know if they're correct.
So we don't know what they are. So let's work on that. So it's super common, and the problem is, what I find is that there's so much conflicting information everywhere people look. So the pet shop will give them a tank that's set up, but it's not, or it needs to be altered as they grow. So people get a tank thinking that that's going to be their tank for their whole lives, which is really sad because often it's something this big. And as a beardy grows, they get obviously, that big. So it's a bit sad that they're being told that. And then they go on Facebook and Google and all sorts of things, and they're getting all this different information and probably a lot of like American information and stuff that's not even, quite relevant here. And Facebook is horrible. To them. Yeah. So they might think they're doing the right thing by asking for advice on a Facebook group, and then they'll be torn apart by people thinking that they're
Muppets.
They're doing the wrong thing. Or they're killing their animals or something horrible like that. So a lot of our job is education on how to keep these guys with their specific needs. And, a lot of the time they're coming in not knowing that they're doing the right thing, and they always feel really bad because they're like, well, I was told this, and I'm like, I'm sorry, sorry that you got all that wrong information or like conflicting information. It gets really confusing for them. So they want to do the right thing. Unfortunately,
it's just they haven't sort of set out on that right path, I suppose.
Well, it's other people.
As
well. It's everyone thinks they're entitled and know what they're what they're talking about.
Everyone thinks they're an expert.
And I'm not saying that all the vets are right as well, but we're trying to we try to keep consistent information so that we're getting those basic things correct at least, to give the animal the best chance. But you can't fully replicate a natural environment in a tank.
No.
Unfortunately.
Yeah. And I'd say where you are now working at UPV, you have access to all the sort of best information there.
Yeah,
there is on sort of.
We try to keep very up to date with our information. So whenever there's a new article or like research out about something to do with these guys, we all try to jump on it and learn from it, and we'll change our protocols if we feel like that's necessary. So I think that's really great that we're quite evidence-based.
Yeah.
Absolutely.
So
absolutely.
What was it called again where you work? Sorry?
Unusual Pet Vets.
Yeah. They're Australia-wide, aren't they?
Yes.
Or East Coast anyway, aren't they, as well?
They, we only worked this out before they started in 2012. Is that what we
2012, you said, yep.
And yeah, they quickly grew. And like almost every year, I feel like we're getting a new clinic. And the Adelaide one is quite new, so that was 23, end of
23, because
November 23.
We were deciding what we were going to do in Darwin, and then this opened, and then your opportunity obviously came up.
Yeah.
So we came back.
Yes, we opened in November 23. And it was sort of like a slow start because everyone was learning that they could come to us with their exotic pets, and now we're just busy all the time.
Yeah. It's nice to have something like that, though, I imagine.
So strictly, just exotic practice.
Yeah.
That.
So we don't see cats or dogs at all.
I was going to ask that, yeah.
No, they're not allowed in the clinic.
Yeah. Do you guys talk between like other clinics about if there's something comes up or?
Yeah, so we're all connected via our UPV network. So if we ever got any cases that we're not sure about or like need advice on, or someone else has experienced it, we can post that on our big group, and any of the other vets can like give their advice. Or other information that they might have. So like some things that we see here might be something that like a clinic in Canberra might never see, or vice versa. Like some states don't have rabbits at all. They're illegal to keep as pets.
Really?
Yeah.
I didn't know
that. Or ferrets.
Yeah.
So if there's randomly a case comes out and this person's never worked with a ferret, they might ask about it, and some of us who've worked with ferrets will be able to give them some information.
Okay.
So yeah, super useful. And that's sort of the best way that we can learn is by bouncing off each other.
Yeah, well, that's what science and everything's based on, isn't it?
Yeah, absolutely. And like the network of all these clinics is fantastic as well.
Yeah.
It's good that you can just, if you need to speak to someone in Queensland, you can just, speak to them and get advice on something like that. It's a great sort of network that you have. And UPV is sort of taking over the exotic game for vets in Australia, I suppose. Like you said, always opening a new clinic somewhere, and give it another couple of years, there'll be even more of them. Bloody everywhere.
Yeah.
So let's turn it back towards snakes now, I suppose. Just a few sort of common reasons why people would bring their snakes in to see you.
So I'd say the most common is they're not eating. So they're just refusing their feeds. And that's a really non-specific symptom of something. Or it might not even be pathologic, so it might just be that it
middle of winter.
Yeah, winter time, and it
just doesn't want to feed.
It might be a snake owner, and they don't realise that that's the case.
Yeah.
But sometimes people come up and they're like, "Well, he hasn't eaten in 18 months or something like that."
Yeah. Okay.
And usually by that point they're quite underweight and they've got several other issues going on as well. Or it could just be, he's refused his last feed. And I'm like, oh, well, I'm not that concerned about that.
Yeah.
So we just sort of go through all their husbandry, make sure that everything's where it should be. We might do some tests at that point, see whether there is an immune response happening, in case there is some sort of infection or inflammatory response going on in the body, which might indicate that there is a pathological reason for whatever's going on. And we just sort of go from there. Or lack of shedding is probably another really common one, and that sometimes just comes hand in hand with the not eating. And sometimes it's as simple as we need to get them to shed and then they'll eat.
Yeah.
Because if you imagine being stuck in crusty old skin, it's pretty horrible.
Yeah.
So there's a reason they're not eating. So it might just be the fact that we are in Adelaide and it's really dry and they can't shed because they're not humid enough in their tank. So we just up the humidity, they shed, and then they eat.
Yeah.
That's probably that's best case scenario.
Yeah, I was going to say.
But yeah, there's like beyond hundreds of reasons why they might not be eating. A change in behavior is something else that is quite common for people to bring their snakes in. So they've started being aggressive where normally they wouldn't, or something along those lines. Or they're hiding away and they haven't moved out of their hide in however long. So ruling out sort of other diseases, you can also get just pain going on. So a snake is just one long spine. So spinal diseases are really common and really painful.
I guess the thing with like reptiles too, especially snakes, they obviously can't show emotion. So it's hard, especially for people that don't, aren't too experienced.
Don't know what they're looking for.
Yeah, it's not like the snake's got like a dog and whimpers or something like that. Pain, you just,
it's just going to curl up in the corner.
Yeah,
that's
exactly.
Right.
Yeah.
So it's they hide away. They don't want to interact with anyone. If you try to interact with them, they get aggressive because they're uncomfortable and they don't want you to touch them. So that's some of the things that you might see. And sort of the way that they move sort of tells us whether they're like really stiff or uncomfortable, or certain parts of their spine might be really stiff.
Yeah.
And that's something that probably owners don't usually pick up on, or they just can't strike because it's all in their neck.
Yeah.
And it's really, really uncomfortable, or something, those sorts of things. So we can sort of feel that stiffness, we can test their mobility, and then x-rays also tell us a fair bit at that point, because those sorts of conditions are usually degenerative, so they tend to get worse over time.
Yeah.
And sort of the longer that they sit there, particularly if the snake's either not moving at all or being handled too much, the spine tries to protect itself, so it sort of remodels itself, and all the bones in there will get like thicker and thicker, and then they won't be able to move at all.
Yeah.
So that's another, I guess, relatively common and also not easy to diagnose, but you should be able to see those sorts of signs on an x-ray pretty clearly. So.
Pretty clearly for you. I wouldn't know what I'm looking at on an x-ray.
That's why we take animals to vets.
That's
exactly. Yes.
It's always nice when not nice, but if they've got one section of spine that's abnormal and then the rest of it's normal, you can be like, can you see that? And then can you compare it to that?
You can show the difference.
And you can be like, yeah, this is normal and this is not. And that does help a little bit as well.
Yeah.
All right. So yeah, cat and dog teeth. Just introduce infection into wounds, and then if left untreated, depending on how deep they are, they might go septic after that.
Would you say, obviously, cats probably more likely for infection than dogs, generally speaking, or just from...
Theoretically, yeah. Like if we get bitten by a cat at work, we're more likely to get a worse infection than if it was a dog. So yes, probably. And they're probably, I mean, hit by cars, again, it's mostly spinal related.
Yeah. Spinal
injuries. And things like that. And yeah, other than that, it's like they're dehydrated because they've been stuck
somewhere.
That, you found them in a pool with no water or something like that.
Yeah.
And so we give them pain relief, we give them fluids, antibiotics if that's what's necessary. We've had, if there's like lacerations in the skins, then we can stitch them up, depending on how big the laceration is. Spinal injuries are tricky. It depends on how bad they are. If they're not that bad, then pain relief and rest is really the only way to treat them.
Yeah.
And you release them when you think they're fit to be released and survive in the wild without pain relief.
Yeah.
Basically.
Just back to infection quickly. Do you reckon of most, like any time a snake is sort of decently sort of attacked by a cat, would they always need antibiotics, or is it just something you test for at the time and you can work out if they need it or not?
It's a good question. That's really dependent on probably how many bites there are, how deep they are, where they are, those sorts of things. Most of the time, if the tooth has broken through the skin, it's an infection risk.
Yeah.
So we try to treat that at a local level. So we try to flush out those wounds as much as possible to get rid of the bacteria that's sort of sitting in the puncture wound. And then we put them on systemic antibiotics, so treating any bacteria that might have gotten into the bloodstream already.
Yeah. Okay.
Yeah.
Interesting.
So sort of going on from that, when a wild snake does come in with an injury, say if I bring one home, the sort of deciding between treatment, rehabilitation, or just straight euthanasia, I'd like to think I'm pretty sort of level-headed on that. If I get a snake with an injury and I see it and like, yeah, that's not going to make it, I can make that decision for myself.
Yeah.
But
so
obviously I do bring stuff in to you for a second opinion.
Yeah,
as
so
well.
Normally you've already said this one looks really bad.
Yeah.
And if you think it's bad, it's probably pretty bad. So you just need me to confirm it, really.
Yeah.
But any spinal injuries that have led to paralysis, so meaning that they've injured the spinal cord, so they can't move part of their body, that can't be released, so it has to be euthanized. If there's wounds that are like around very specific parts of the body which would have vital organs, or like around their head, sort of area is really bad because it could affect the brain or the way that they can eat food and stuff like that. So our main priority with wildlife is to return them to the wild. So if they cannot be returned to the wild, and like we're very happy that they can live and eat and do all those normal things, and we can't release them, we have to euthanize them.
Yeah. And again, it's that sort of making obviously the best decision to benefit the animal.
That's right.
In that sort of circumstance. And again, like there's no point having something suffer for the sake of trying to see if it comes good or something like that. It's,
there might be some cases where you say we can try this for 24, 48 hours, like some of the neurological cases where a snake looks like, for lack of a better word, its brain isn't working, so it's not acting correctly or in its right mind. Then those sorts of cases might come good with some supportive care, so getting them warmed up, giving them pain relief, anti-inflammatories, stuff like that, or fluids. They might improve, and if they do, then it might just be a wait a little bit longer, see if they continue to improve back to normal. But if they don't improve or they get worse, then we make the best decision for them.
So I guess like I've only thought about this now. I guess some snakes would actually get concussion, wouldn't they?
Yes.
So
they might improve depending on how bad it was.
Yeah. Because I think last year I caught a hatchie Eastern Brown that was at a school, and they obviously tried to put something over it, and they didn't do it. They did it right, but at the time there wasn't a scratch on it, but I thought he was dead. And then I'm like, oh, I think I had another call to go to, so I put him in a bag and secured him and just see how he goes. Went to get him out when I got home. I'm like, oh, he's alive, and he was fine. 100% fine.
Yeah.
So I wonder
whether just stun them.
Yeah.
And then they go, whoa,
what's going on?
And like they're dizzy and they're disorientated.
Yeah.
So that might happen initially.
Yeah.
So yeah, and you give them a bit of time. And if it was like they got whacked in the head, you might need a bit more than that. So you might need anti-inflammatories so stop brain swelling up and
all that sort of stuff.
Sort of stuff. But yeah, you might be able to give them some time.
Yeah.
As long as it's not, they're not injured in another way.
What might cross my mind was maybe like asphyxiation, because the thing they put over them was pretty airtight, whether they just didn't have enough air and just passed out essentially.
Probably pretty unlikely for a snake, but so many other things can cause those sort of signs. So like if they did get heat stroke, or they were there for days and they were dehydrated or something, they'll show neurological signs. So it's not just head trauma that causes it, but that's probably one of the more common ones.
Obviously, being wild animals, stress would obviously affect them in these situations as well. Does that come much into play during treatment and recovery when they're injured, the stress factor, or not as much?
Stress in any animal can delay their recovery and their healing. So their immune system almost shuts down if they're really, really stressed. So with wildlife, it's more about trying to keep them in low traffic areas, so not a lot of people around them, not too much handling. Obviously you need to handle them to give them medication, but if you can go for alternatives that you only have to do, like for example an injection every 3 days rather than giving them oral medication twice a day or something like that, and that's sort of what you go for. Keeping them in a dark, secluded area where there's not a lot of noise, and trying to replicate their natural environment as much as you can. Is really the big ones.
So that's the thing with reptiles, is they don't just recover; they take so much longer than mammals, birds, all that sort of stuff. To recover from stuff like this.
Because I guess like the notion around reptiles a bit too is that they're pretty hardy, which I guess in a way they are.
They are,
but at the same time they're very fragile.
Yeah, that's right. Yeah, it's sort of hard to describe them really. They're they deal with a lot for a really long time. Because that's just how slow they work. But like a turtle could be sick for 20 years.
Yeah, right.
And then come into us. So like they're just, and it's also dependent on what people can see and what they know is healthy or not. But they work very slowly. And they deal with a lot. Turtles in particular, super resilient.
Too resilient.
Too resilient. They should really start showing that they're sick a little bit sooner. But yes, they deal with a lot.
Yeah, for sure. So moving on into sort of clinical stuff when you're dealing with venomous snakes versus non-venomous snakes. I mean, obviously there's a lot of differences and a lot of obviously extra safety protocols to sort of take into account when dealing with venomous snakes, whether that's wild or captive. So say someone brings in a venomous snake for you to look at that's a captive, what sort of procedure do you go through from that sort of process?
We need to make sure that whoever's bringing it in is we know them and we know that they're confident in handling whatever the venomous snake might be. So they need to have their own equipment to tube the snake or otherwise restrain it so that we can examine it safely. We all have venomous snake handling training, but it's just safer for us if there's someone else who's already knows how to handle them, gets them into that position first.
Yeah.
And then if we're doing like surgery and stuff, with anesthetics, we tend to put a tube in the airway of whatever animal we're doing a procedure on. With venomous snakes, if we know exactly what we're doing and we have a nurse that's super confident as well, we can safely put a tube in its airways without obviously envenomating ourselves. Or we've got other ways to sort of combat that. So we can still keep them in the tube and then connect them to like anesthetic gas that way.
Just fill the tube up pretty much.
Yeah.
Yeah.
But it's a lot slower.
Yeah.
We're relying a lot on the fact that they're going to breathe in that gas rather than hold their breath, which is something that reptiles like to do.
Yes, they're good at that.
And it's going to take a lot longer if we can't breathe for them and put the gas directly into their airways.
Yeah.
And it's safer for the animal if we can intubate them. So put the tube in.
Yeah. So
that if something goes wrong and they stop breathing by themselves, we can breathe for them.
You can take control of that.
Yeah.
Yeah. I suppose this is why, well, me in particular with the training is so big on getting people to learn how to restrain these animals, because
and putting them into
tubes, pinning, all that sort of stuff, because something's going to happen. You're going to need to take that animal to a vet at some point. Like you're not just going to keep a snake for 20 years and not expect to, something to happen.
Yeah.
Even if it's as simple as a stuck eye cap, or something like that. If you don't know how to restrain that snake, you're not going to get that eye cap off. That's going to go infected, and then you're going to have more issues from there. And like you said, if they don't know how to handle the snake properly, then like what do you do? Like
I can't touch it.
Yeah.
I'm not going to put myself in danger to pick the snake up myself. I'm going to be useless to you if I get bitten. So,
are you allowed to restrain them if it came to it, or do you have to, like, is it protocol for the person that comes in has to restrain them?
I think it's our protocol that they have to be restrained. So like if something happened and like it was loose in the clinic or something like that, like in the consult room, like our protocol is to leave the room and call a snake catcher if that person wasn't
confident
in doing that. It's like performing CPR on a person. If you're in danger yourself, you're not going to be helpful.
No, exactly.
So,
yeah. Which again just goes back to the training side of things.
Yeah.
If you're looking at getting a venomous snake, you need to know how to tube it, restrain it.
Yeah.
Because again, if you do need to take it to the vet one day,
you're
going to need to do that.
Yeah.
So
and like we might only see like 1 or 2 venomous snakes a year.
Yeah.
As well. So even if we've done our training,
you don't do it enough.
It's not like
I wouldn't be confident to be like, I can tube that snake.
You're not in here tailing snakes with Brett all the
time.
Nah.
No.
You just call me and come in to do
it. I know a guy.
All right, so going on to surgery in snakes, particularly venomous snakes, would I be correct in saying that one you stitched up that I brought in is the only surgery you've done on a venomous snake? That brown snake?
Yes, I think so.
Yep. Do you just want to talk us through that process and that sort of particular injury and sort of everything that went on?
So that one was like a laceration along the body. So like part of the skin was ripped off. So it was like exposing muscle. And it was quite contaminated as well. So there was a lot of dirt and things that were already in the wound. So basically with wounds in any animal is that you have to remove the contamination first. So you need to flush the crap out of it until you get everything, all the dirt and muck out of it. Make sure you've got clean skin. If you've got any skin that's been like really damaged, you might need to remove it. And then if everything's clean and you've still got, so in this case, there was still a flap of skin, which was really helpful. So all I had to do was stitch the flap back onto itself, essentially.
Yeah.
And with reptiles, because they have scales, we need to do certain types of sutures in their skin to make sure that the skin edges sort of go up like this. because if you put scales on scales, it's not going to heal.
Yeah.
It's just dry on dry.
Yeah.
There's nothing going to happen there. So you've got tissue underneath the scales, that skin, that's the bit that heals together. And then with reptiles, if it was a pet reptile that wasn't venomous, we would remove the sutures like 2 months later.
Yeah.
You don't have to do that because luckily they shed their skin. So eventually they're just going to shed the sutures off. So for wildlife cases, we just leave the sutures on there.
Yeah.
And it'll eventually come off.
Yeah.
And then this particular case, because it was quite contaminated, we did do a course of antibiotics and anti-inflammatories for the pain as well. And then after we finished that course, we released it.
Yes. Yeah, that was the call out that I did for you last year.
Yeah,
up your way.
Yeah.
You were busy.
Yeah.
And then, did that. And then, that's the one we came back to you to release.
I guess that's the hard thing with, what we do and needing snakes needing treatment too, because we're not carers either. So we're not allowed to rehab, which technically allowed to rehab. Like we just catch and release. So which sort of creates an awkward problem when there is sort of something serious like that. But I guess like you said, like you can leave the stitches in and they'll just
so you sort of do almost the bare minimum.
Yeah, to get them through.
Like as quickly as possible.
And generally, like their immune system should be pretty good if it's a healthy.
If it's a healthy animal,
being in the wild, it's survived. Yeah.
If it's in good body condition.
You think of all the stuff that they go through.
Absolutely.
They cop it.
Yeah. If it was, and that's sort of where the decision making comes into it. Like if that particular snake, for example, was emaciated, so really, really skinny, we probably wouldn't have done the surgery because it probably wouldn't have made it through.
Yeah. Euthanize.
Yeah. And obviously with a surgery like that as well, like from memory, the injury was sort of on the neck somewhere. Or a bit down. I think it was like that far down or something. So it was in a really
third down its body
awkward position because it was just at a point where you couldn't, like if you put it in a tube, it'd be past the injury.
Yeah.
So I had to sit there and pin it while you did the surgery on it.
And we know how quickly your hand can get sore.
Yes, absolutely. Absolutely.
Yeah.
But
it was still anaesthetized, but to be safe.
Obviously, you wouldn't just.
And then my nurse was monitoring the anaesthetic while I was doing the surgery as well.
Yeah, you wouldn't just have a brown snake sitting there while you're doing surgery on it.
Yeah, say like not restrained. Like less signs to pick up on if it's coming out of it too. I guess like if it's not like obviously is restrained, but like there's obviously less signs with snakes compared to dogs or.
It's sort of they're a bit more subtle, but usually the easiest way to tell is muscle tone. So. They'll be completely flaccid if they're knocked out.
Yeah.
And then when they sort of start waking up, probably
you'll feel it.
Tension starts. Yeah. Like if you flip its tail or something, it will probably be like
flip back.
Yeah.
And it's rest rate and its heart rate do things as well.
Yeah.
But yeah, I'd say muscle tone is the easiest way to tell with a snake.
Yeah. So that's the only venomous snake you've performed surgery on.
Yes.
Have you got any other interesting cases that you've done surgery-wise?
Yes.
On captive animals?
I had a python. I think it was a wommer. It was a pet python. And it had like a swelling sort of fairly low down on its body. It was really, really hard. On ultrasound, it looked fairly cystic. Ended up going to surgery to sort of work out what it was. And it ended up being a kidney tumor. And it was like this big. It's crazy. But the snake also had a heart condition as well. So as we were doing surgery, its heart was getting bigger and bigger and bigger because it was filling up with fluid. So I had to remove fluid from its heart whilst we were doing the surgery as well. So
made your money that day.
Yes, that was
stressful.
Very stressful.
There's a lot going on there, isn't there?
There was a lot going on. Unfortunately, I ended up euthanizing it because it was a kidney tumor, plus it had that heart condition that was just getting
too much
worse
going
by
on.
the minute. And I was like, this is not going to end well.
Yeah.
So But that was very interesting to see.
How common are cancers? Like, do you come across them quite a bit?
Yes,
or?
we do. I'd say they're just very underdiagnosed, and we're now, because more people are wanting to spend money on tests and things like that on their exotic animals, we are diagnosing them more.
Yeah.
So they are actually much more common than we realise.
Yeah.
I would say.
What about viruses and stuff like that as well? Are they sort of not becoming more common, but are you finding more because people are willing to go out and get tests done?
Yeah, people are, again, more willing to spend money so that we can do these tests and confirm whether we have viruses or whatever it might be. So snakes get respiratory diseases that can be related to viruses, or neurological diseases which can be related to viruses as well. Nidovirus is pretty common, or diagnosed a fair amount, I guess, in these respiratory cases. Adenovirus in bearded dragons is super, super common because 50% of them have it.
33% of the wild ones have it as well.
Yeah.
I think it's 1 in 3.
And nidovirus in blue tongues as well, and shinglebacks is maybe not as common, but we do see it. They're probably the most common viruses. I don't think I've ever had a virus in a turtle that I've diagnosed here.
It's interesting.
So I suppose the main ones for the snakes are Nido. We haven't had sunshine here, have we, in SA?
No, I don't think so.
And mycoplasma is the other one, isn't it?
Yes, but that's not a virus.
Yeah.
Jeez, bro. Conditions, I guess.
Conditions. Yeah, it's a bacteria, isn't
it? It's a bacteria.
Yeah.
They tend to come hand in hand because viruses tend to reduce the immune system, and then bacteria jump on the bandwagon and go, woo, I can take over here. So then they start arcing up.
Yeah.
That's the easiest way.
Arcing up.
Just back to the cancer thing quickly. Have you ever had a reptile, a snake in general, maybe? Have you ever had a skin cancer?
Yes.
Yeah.
I don't think whether we ended up sending that off to be tested exactly what it was for. I had a python that had this huge lump on its side that was in the skin. And it was, when I removed it, it was sort of coming out of the body wall. So it was sort of coming from the muscle layer.
Yeah.
In the side of the body.
Interesting.
So that's probably the only skin one I've seen in a snake. Usually they're more like blisters and sores.
Yeah, the reason I say that, when I was at Venom Supplies, they were getting papers at the top. They were giving data to people that are doing papers on skin cancers on wild snakes, obviously venomous snakes in the wild and that sort of thing. And they actually had because they have wild caught stuff that comes in. They had a couple, I think it was a dugite, that had like a literal, like similar to what we get, like a, I guess it's not a mole, but whatever sort of similar thing, but in a snake. Like, it was just a funny orange looking thing on their scales. And skin care is a actual skin care,
right.
like, pretty much like what we get. And I think someone's doing studies on it anyway.
Yeah, so to diagnose that, most of the time we need to remove it and send it off to be tested so the lab can chop it up and look at it microscopically.
A biopsy?
Yes, that's biopsy.
Yeah. You know what's going on.
I only know that because I've had moles cut out.
And the sort of less invasive way to test it is to do a fine needle aspirate, so sticking a needle in it and then looking at the cells that you get under the microscope.
Yeah.
But it's much more accurate if we do a biopsy.
Yeah.
So sometimes you do the FNA and then it'll come back as it's probably this.
Yeah.
But you should really confirm it via biopsy.
Yeah.
But usually we sort of want to start with the less invasive thing first.
Yeah, sure.
Of course.
In case it is something that's really obviously benign, and then you don't have to remove it.
Yeah.
So going on quickly to just before we finish up, snake bites in pets and stuff like that. So obviously when you weren't working at an all exotics clinic, back when you were at just general practice, did you see many snake bites for cats and dogs?
I personally didn't, but there are a lot.
Yeah.
That I just never been in the right clinic at the right time to see a lot of them. I think I've only seen like a few cats and like sort of suspected ones, or I've been to emergency clinics where they've already there's like 5 animals in hospital that have been bitten by snakes, but they've already sort of gone through that whole antivenom
process
thing. So I haven't done a lot sort of starting the management of that. But in general, cats are a bit hardier, so they might be able to get through without antivenom, depending on how bad their signs are, their clinical signs. And then dogs they tend to go from 0 to 100 really quickly. So we tend to do antivenom with them as soon as we possibly can.
Yeah.
Yeah. Yeah.
So I think another vet's told me, like with dogs, they get bitten. If they're envenomated, they have like almost a reaction straight away. Then they come good for a little bit.
That's
and then people made the mistake of thinking they're right, and they just go bang and they're downhill straight away.
So they tend to sort of collapse and then get up and seem fine, and then they'll get really sick.
Yeah.
So, we follow the acronym dumbbells, which I won't remember all of them, but like, it's like D for like diarrhea, U for urination, M for I think it was meiosis, B for something else. But it's like all sort of the signs that you see. It's going to be like vomiting, diarrhea, salivating.
Yeah.
They sort of lose control of all their bodily functions.
Yeah.
And for cats, I think the most common sign is hind limb paralysis. So they'll stop using their back legs. So often it's like cats go missing. So with cats, it's often they go missing for 3 days and they come back into their house and they're dragging their back legs. And they might still be eating and everything, but they're just like
just a bit. And then that's just what cats will do, isn't it? They'll just go off for a few days and the owners will think nothing of it because they might do it all the time.
Yeah.
And they'll just sort of sit somewhere, won't they?
Yeah.
Yeah.
They tend to, though, have a worse reaction if they get bitten twice.
Yeah.
Right. Would that be would they more likely to have an allergic reaction than the second time? Yeah.
Do cats and dogs present different symptoms depending on the species that's bitten them, e.g. brown snake versus red belly, or is it just a sort of...
Yeah, so that's going to depend on the type of venom that they have or the type of toxins that they've got in their venom. So some snakes have anticoagulants, some have procoagulants, so it might either stop the blood clotting or clot the blood. Paralytic toxins, so cause them to become paralyzed. Cytotoxins, so like local tissue inflammation. There's quite a few different things. And I can't remember exactly what they are between all of them.
Obviously, would reactions be worse for different breeds as well of cats and dogs?
Cats and dogs.
Yeah.
Well, more like if a pug got bitten, it's probably going to die.
Just because they've got so many.
Because they're not.
It's
not there
if,
anyway.
if they're already struggling to breathe and they get bitten, and that's going to cause them to vomit and salivate and do all those sorts of things. They're already struggling up here. They're really going to struggle.
Yeah.
So it's more like that. It's not so much like this particular breed of dog is more sensitive to a snake bite.
Yeah. Yeah.
It's probably like more on size as well. I guess like a bigger dog.
Yeah.
And not getting a full bite or something. Compared to a little dog getting a full whack. Like it's going to be different.
Not be ideal.
Yeah.
Yeah. So I suppose if anyone has any suspicion that their pet has been bitten by a snake, what is your sort of best advice for that situation? Do they need to do anything or just straight to a vet.
Yeah, don't wait. Go straight to a vet. There's no point wrapping them up or anything like that. Most of the time, people won't see where they've been bitten. So don't waste time trying to look for a bite. You're probably not going to find it. What you can do when you when you see a vet is that if we're not sure it's been bitten, there are blood tests we can do to see if they have. So, if I've got this right, brown snakes are the ones that cause lack of blood clotting. So we can take a bit of blood and see if it clots within a certain amount of time in a special tube. And if it doesn't clot, then it means they most likely have been bitten, and we can start antivenom.
So it's probably like the misconception that when pets, especially like even with humans as well, that when they do a test that they like detect venom in the system, but that's not the case. They pick up the side of the effects of that is how they work out. Yeah.
Yeah, it's sort of it's a bit off topic, I guess, but when we do blood tests, people often think that we can detect cancers in a blood test. Well, no, we can't do that. We're not going to pick up cancer cells like that, unless it's a raging lymphoma, but that's something else. If it's going to be the effects of the cancer. So if the cancer's in the liver and the liver's not working, the liver proteins are going to be elevated.
Yeah.
So it's the effects of it. It's not going to be a direct answer. Like there are tests that can be like, if you knew exactly where the animal got bitten, there are tests where you can like take samples of that and you can see whether venom is on there.
Yeah.
But the reliability of those tests is quite low.
Yeah.
So we don't rely on them.
Do dogs and cats have allergic reactions to it as well? Like people do? Yep.
Yeah. So you need to monitor them quite closely. They can even have a reaction after they've been given the all clear and they go home.
Yeah.
They might have one.
Just again, like people can.
Same thing,
Yeah. Exactly the same thing.
Yeah. So while you're giving venom, we basically monitor all their vitals really closely for like mainly the when we're first putting it in for a certain amount of time.
Yeah.
And then once they pass that point, they're usually okay for the rest of the antivenom administration.
So then it's the same, adrenaline if they...
Yes, adrenaline.
Yeah. And then I guess it'd be the same thing as if they get bitten again, there's that chance they could have an allergic reaction of the second time. Once they've been exposed to it. So
yeah. So basically the message of that is if you think your pet's been bitten by a snake, just get it to a vet as quickly as possible.
Don't be posting on Facebook.
What snakes is?
Sure.
My dog's been throwing up and diarrhea.
Take it to the vet.
Worst case, they do it bloods and they're fine, and you take them home.
Yeah.
And if you want to be sure that your pet's safe, spend some money on it. Sorry, but
yeah,
it's we have
bloody. If you can't spend money, don't have animals. Basically,
pretty much.
Yes. I think we'll wrap it up there. That's been a good.
How long's it been?
A while.
Over an hour.
Over an hour.
So goodness.
You've had the longest episode so far, probably.
And you were worried about.
Wait until you go flipping it all.
Nah, it's been good. So yeah, we'll wrap it up there, guys. Thanks for listening. Thank you, Amelia, for coming on.
Thanks, Amelia.
You can wander back
inside
a long
now.
Way. Yeah, just walk back outside in the back of the house now. Go chill out for your Saturday evening now that you've done this. Yeah, thanks for listening, everyone. Make sure to like, comment, share, subscribe, all that good stuff. This episode will be out Wednesday as usual. So yeah, thanks for listening, and we'll see you in the next one.
Cheers, guys.